Welcome to the program. I'm your host, Neil Howard. Glad that you could join us this evening here on Health Professional Radio. We're going to be talking with Dr. Alicia Bazzano, Chief Health Officer for Special Olympics, and she's joining us on the program to talk about the resources that they've added to their website in response to the COVID-19 pandemic, providing some very critical information to their athletes, caregivers, and loved ones of individuals that are living with intellectual disabilities, or ID. And she's also going to talk a little bit about School of Strength. It's a fitness campaign in partnership with WWE that aims to help athletes stay active. Welcome to the program, Dr. Alicia Bazzano.
Thank you so much for having me. I really appreciate the opportunity to get to talk to you a little bit, Neil, about patients and people with intellectual disabilities.
You're Chief Health Officer for Special Olympics. Have there been some major changes? I know obviously there have. The entire society is changing. Is your organization changing drastically as well?
Absolutely. At Special Olympics, we are following the physical distancing just as every other organization is. And at the same time, we're connecting very closely with our athletes. We're committed to doing everything possible to prevent the spread of COVID among our athletes and everyone in our community who have intellectual disabilities and who don't. So while we aren't having practices, we aren't having competitions in person, we are staying connected to our athletes. Mm-hmm. We've armed our athletes with information on how to protect themselves from exposure to COVID, including a number of videos, and we're working with them to keep them fit and healthy at home, both healthy in mind and in body.
Now, we've talked about segments of the population that are deemed at higher risk of COVID-19 and the consequences thereof. Are people with intellectual disabilities, or ID, a higher at-risk group than other folks?
Yes, people with intellectual disabilities are among the high-risk groups that are identified by CDC. They're at increased risk of respiratory disease, of pneumonia, of death from pneumonia, and as well as a number of other underlying conditions like obesity, diabetes. In addition, people, for example, with Down syndrome can have low tone in the airway, can be prone to respiratory infections. If you have cerebral palsy, that condition can come along with scoliosis, can come along with reduced muscle tone, both of which can cause issues, including increased pneumonia, increased risk of inability to deal with secretions, all of those increased risk. However, really the most important risk for people with intellectual disabilities isn't necessarily the underlying condition, but the lack of access to health care that they come in with in the first place. Really, we need to address that. And as you've seen for example, in New York, in the New York Times, we had that study that showed that residents in group homes and surrounding areas were 5 times more likely than the general population to develop COVID and 5 times more likely to die from it. A lot of that has to do with making sure that we are there and that we prioritize people with intellectual disabilities in recognizing the symptoms and making sure that we are doing the physical distancing and addressing that as we can, and in making sure that they're getting the health care that they need.
You know, underlying conditions seems to be the word that we hear, the word that we now fear, as opposed to, just a year ago, underlying conditions were, well, you have an underlying condition. Now it is a very serious matter. Would you consider one of the underlying conditions being that a lot of the conditions that you mentioned, the pneumonia, the diabetes, all of these things are conditions that doctors are well versed in, well knowledgeable, but are they as versed in treating those conditions in someone with ID?
Oh, what an excellent question. There are definite differences in addressing people with intellectual disabilities, in assessing and in treating them. And unfortunately, health professionals don't have the training that they need. So although health professionals are out there every day risking their lives and working hard, including for people with intellectual disabilities, over 80% have not been trained on how to treat someone with intellectual disabilities. So we at Special Olympics are creating an online simple training with just a few steps that can really address how to treat people with intellectual disabilities as it relates to COVID. And this can be used by everyone from paramedics to physicians to nurses, all the frontline healthcare workers around the globe. And we really can do what we need to save these lives. And if we just do a little bit of training, we'll get much closer.
Well, what steps can healthcare providers take that maybe they aren't taking now or didn't think of?
There's 4 easy steps that healthcare providers can do. First of all, you can communicate clearly. Make sure you're not using any medical jargon or crossword puzzle words, really. Plain language as much as we can, and then also using visuals as much as we can for reinforcement. Secondly, you can ensure that your patient has a support person available, ideally in the room, or if not in the room, then on the phone, on a video call, so that they're able to be supported, so that they're able to enhance that communication, make decisions, and that'll also actually decrease anxiety and decrease any behaviors that might occur because of that anxiety, putting everybody in a better position. The third step, and this is really one of the most important steps, is to prepare your patient for any COVID testing or procedures that might be necessary. So a nasal swab, for example, is hard for anybody, but for patients with intellectual disabilities, there's a lot of potential misunderstanding of why it's needed and potential discomfort. You know, if you have Down syndrome, sometimes the facial structures are different and that may create issues. Or, for example, with autism, there's a lot of sensory sensitivity. So coming at you with a nasal swab that goes into your nose can provoke a reaction. So doing that preparation and having people first explain what you're doing, either demonstrating on yourself, another person, or on an object like a doll, that's very helpful. And then just walking a person through it and talking through as you're doing it step by step can be really helpful. Similarly, with a chest x-ray, it's very hard to understand the need to lie still. It needs to be communicated first, demonstrated, and then allow the person to do it. And then the final step is equally important. You need to help your patients to understand your instructions for aftercare. So instructions on quarantine, what that means, how long you want them in quarantine, how to take your temperature every day, and really get that feedback on what time every day it is. Give some cues on that, because people may have difficulty understanding time. So at exactly the same time, when you either look on the computer and you see the time, set an alarm, or have a television show that you know that's on, what the use of a mask is, and when they need to use the mask, who can and can't be helping you in quarantine, and what that looks like, how far away 6 feet actually is, explaining all of that, and similarly explaining what happens when you're in the hospital and what those needs are, really doing that demonstration in very, very clear terms. And then finally asking for feedback to make sure that there is confirmation of understanding.
Do you find that the athletes that are involved with Special Olympics catch on a little bit more than some of the people who are involved with Special Olympics that have ID that may not be involved in the group athletic setting?
We actually have athletes across the spectrum for intellectual disabilities. That's an excellent question. And people with intellectual disabilities actually have a range from mild, moderate, severe to profound. About 85% of people with intellectual disabilities are in that mild range. But we serve all of them, including children all the way through older age. And we find that there is a range of understanding. What we're trying to do with everybody at home is to make sure that they are equipped as much as possible to fight COVID, and then also to make sure that we are giving them at the levels that they need the information to arm them and to keep them fit at home. So a lot of what we do is visual, is demonstration, and that's the way that we're recommending for everybody in the healthcare setting.
Now, as athletes, I understand that you have partnered with WWE. Is that correct?
Yes, we do. Now, we have athletes of all abilities. So we actually have done this wonderful series called School of Strength. And these series of videos goes for people who have very little conditioning and are at an introductory level of fitness, all the way up to our highest level of athletes, just so that we can make sure that everybody can be fit at home. It's a wonderful series. that I'd invite everybody to use, whether you have intellectual disabilities or not. Mm-hmm. It's just a great at-home method to use. And we worked with Becky Lynch, who is so much fun and gives lots of enthusiasm and keeps people motivated to do School of Strength.
Where can we get some information about School of Strength and about Special Olympics in general?
We would love to refer you to the website, which is specialolympics.org. And on that, we have our COVID page, which goes through all of the work that we're doing with COVID, gives a ton of resources, and can point you to School of Strength as well. So going there is probably the best place to go.
Dr. Bozzano, thank you so much for joining us on the program this evening. It's been a pleasure, and stay safe.
Neil, thank you so much, and thank you for giving priority to people with intellectual disabilities.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Alicia Bozzano, Chief Health Officer for Special Olympics. Audio copies of this conversation are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.